Good afternoon. I'm here with Dr. Carlisa Gibson, psychiatrist, working with the Department of Mental Health with the district government. Currently, she's employed at St. Elizabeth Hospital. Good afternoon, Dr. Gibson.
Good afternoon, Ms. Cash.
What are your area specialization?
Well, I'm a first-year resident in psychiatry in the Department of Mental Health. So I deal with the preliminary when we see our patients, dealing with their everyday function and how they manage their psychiatric and mental illness and psychological functioning.
Okay. Describe your typical work week.
My typical work week, it's about 72 to 80 hours per week. We go in, we discuss the patients, we admit patients in the day, whether or not they're coming in from the courts or whether or not they're coming from the hospitals or just simply from the community. We manage their care with medication, we have psychologists on staff, and it's what we call a multidisciplinary team, where there are different sets of professionals that are involved in the care of all the patients that are at St. Elizabeth's Hospital.
Mm-hmm.
So my role is a small role, but psychiatry is involving with the medication part of mental illness.
How long is a client typically in counselor under treatment?
Well, St. Elizabeth's Hospital is different from other psychiatric facilities in that it's more long-term care. So we have patients that have been there for over 50 years, depending.
Okay.
So, but we also have acute situations where someone can come in, let's say maybe was on the street and wasn't necessarily cooperative or aggressive or threatening. Then the police can court order them into the facility and they can be there for a few days to a week, depending on what incited that type of behavior.
Okay. And have you ever dealt with a case or client that you were unable to handle?
Well, all the cases at St. Elizabeth's are quite challenging. We have a range of clientele, so yes, you have people that are there that are aggressive. Some can be violent, some can be just inappropriate, or some can make sexual advances. Every case is different, and you always have to remember that these people a lot of the times cannot necessarily control their behaviors. It's a mental illness, just like how someone has diabetes and cannot necessarily control that. We like to think it's a similar pathophysiology.
Okay. And what type of behavior do you usually encounter from patients that have personality disorder?
Well, it would depend on the type of personality disorder. For example, someone that's borderline personality disorder, they like to, what we like to think of is reflect. For example, they like to split groups. They'll have one group that they'll be their favorite, they'll adore and manage, and the other group that would be their enemy. So that's their way of protecting themselves because they have some insecurities about themselves. Whereas if someone is narcissistic, they think very highly of themselves and they talk down to everybody else. So it would really depend on the type of personality disorder we're dealing with. But it can range from a splitting behavior to aggressive to downgrade, sublimation. It varies. But you take it case by case.
Okay. Why did you choose to go into this field?
Well, I think it's one of those underserved areas because of the fact that there's a lot of stigma related to mental illness. People don't actually think that it's something that can be treated. Some people think that it's something that's self-inflicted. And I think that that's a lot of misinformation, and they need more people to get involved to actually try and treat it, to be fair to these patients so that they can get the best possible care, just like patients that have physiological disorders like cancer and high blood pressure and diabetes. It's a different type of illness,
Mm-hmm.
but it's something that needs to be managed in a hospital care.
Okay. How long have you been?
I just started my actual psychiatric training in July. However, I've been training to become a medical physician for 5 years in England, and I've had some exposure in different countries with different types of psychiatric patients and patients with personality disorders. So overall, my exposure to this field has been, I would say, over the past nearly 10 years.
Okay. Well, I want to thank you for your time and look forward to and good luck with your career in this field.
Thank you.
Thank you.
Did you get it? Let's see.